Hi, everybody. Dr. Daniel, and today I'm speaking about the connection between migraine with aura and atrial fibrillation. Well, what is migraine with aura? Migraine with aura occurs in about 30% of the total migraine population. It used to be called classical migraine. The syndrome consists of a vision of seeing spots, holes, half of things, or zigzag lines. This is called a migraine aura, which usually comes shortly before the headache starts, but it may be in the middle or at the end of the attack. This visual specter is very remarkable, and persons who have had it can easily draw what they saw later. This experience is riveted in their brain. In addition to the visual migraine with aura, persons may notice also numbness or tingling, usually starting in one hand or the other, in the fingers, moving to the wrist, next to the arm, and finally to the cheek or tongue, usually on the same side. Rare migraine with aura patients have trouble speaking or writing, which is called aphasia. This is usually the rarest but scariest part of the migraine. Yet the aura symptoms of vision, tingling, or speech are all short-lived, usually lasting less than 10 to 30 minutes, and by definition have to last, according to the International Classification System, less than 60 minutes. After the aura, the migraine experience is a one-sided, severe, throbbing headache, nausea and vomiting, and sensitivity to light, sound, and odors, lasting 4 to 72 hours. The migraine patient usually needs to be down in bed, and the headache is disabling for work or ordinary activity. Migraine is considered to be a genetically inherited condition found in families, found in women, and it's in our DNA. What is atrial fibrillation? Atrial fibrillation is a serious heart condition that has possible strong relationship with stroke. The heart is divided in 4 chambers, the right and left compartments called atria on the top, and the right and left ventricles on the bottom. Normally, the heart has electrical wiring that spreads first to the atria, causing contraction, and then to the ventricles. This 2-beat pattern gives the heart its characteristic sound, lub-dub. With atrial fibrillation, the heart does not beat regularly. The atria just fibrillate, which means they have a quivering movement that doesn't really move blood from the atria to the ventricle like it's supposed to. Blood can collect then and clot if it's in the atrium, and then later the clot may drop down into the ventricle and be sent anywhere in the body, the brain, the left leg, the bowel. The result of atrial fibrillation is irregular, and medical students are taught that. There's no normal rhythm, and it's hard to get a blood pressure reading also. Symptoms of atrial fibrillation may be chest pain, shortness of breath, heart racing, lightheadedness, an irregular heartbeat, or fatigue. TIA or stroke. This moving blood clot is called an embolus, which moves internally through the aorta or arteries throughout the body. When it lands, the embolus blocks fresh oxygenated blood from working where it's supposed to. If it lands in an artery in the right leg, then the person feels numbness and weakness in the leg. If it's in the left carotid artery, the person may have trouble speaking, which is aphasia, or numbness or weakness of the right arm and leg. The emboli then, when they land, whenever they may be going, dissolve in a few minutes, hopefully leaving the blood supply back to normal. This may be a neurologic event, usually lasting less than 30 minutes, and is called a warning of a stroke, a TIA, which is a meaning that series of words that mean transient ischemic attack, TIA. Transient refers to the short time the event may last, such as 30 minutes, and the ischemic process means lack of blood. So, persons with migraine with aura have an increase in TIAs or warnings of stroke. All persons with atrial fibrillation should see their doctor and have a workup of tests. Many of them will need to be on a blood thinner with an anticoagulant medication to dissolve the clots so that they don't go anywhere and bother the body. Some of them will need to have an ablation procedure, which means a removal or destruction of the heart's sinus node, which is the part of the heart that's the spark plug, and so the electrical center of the heart that sends out the electrical beat throughout the heart. What causes the relationship between migraine with aura and atrial fibrillation? The exact cause of this is not understood or not figured out now. It's known that there is a clinical relationship between migraine with aura and atrial fibrillation. These two conditions occur together. One study found that women with migraine with aura had a 30% higher risk of atrial fibrillation than women without migraine. Atrial fibrillation affects millions of people worldwide, and its prevalence increases with age. Other common risk factors include high blood pressure, heart disease, overweight, diabetes, and a family history of the condition. Symptoms of atrial fibrillation can vary from person to person, ranging from palpitations and fatigue to shortness of breath and chest pain. Some individuals may not experience any noticeable symptoms, making it essential to diagnose and treat the condition promptly. Other research proposes that migraine with aura and atrial fibrillation may share common underlying mechanisms. Both conditions have been associated with dysfunction in the autonomic nervous system, which registers various bodily functions, including heart rate and blood pressure. Additionally, both migraine with aura and atrial fibrillation have been linked to inflammation and increased oxidative stress. These shared mechanisms could explain the observed association between the two conditions. Triggers for migraine with aura and atrial fibrillation. Both conditions can be triggered by stress, alcohol, hormonal changes, lack of sleep, and environmental factors. For migraine with aura, common triggers include bright lights, strong odors, loud noises, weather changes, heat, trouble sleeping, and avoiding these triggers can help reduce the frequency and severity of migraines. Similarly, individuals with atrial fibrillation are often advised to avoid excessive alcohol consumption, caffeine, and certain medications that can exacerbate the irregular heart rhythm. That means makes the rhythm worse. Managing both migraines with aura and atrial fibrillation requires identifying individual triggers and making necessary lifestyle modifications to minimize their impact on daily life. Diagnosing migraine with aura and atrial fibrillation. Accurate diagnosis of migraines with aura and atrial fibrillation is essential for effective management and treatment. Diagnosing migraine with aura typically involves a thorough neurologic and medical history and physical examination. The doctor may also order additional tests such as brain imaging, an MRI scan or CT scan, and blood work to rule out other possible causes of the symptoms. Diagnosing atrial fibrillation typically involves an electrocardiogram, ECG, to detect abnormal heart rhythms. In some cases, additional tests like a Holter monitor, which is a little electrical series of pads that are put on the body and monitor the heart rhythm for like a day or a week. That's called an event recorder. It may be used to capture intermittent, irregular heart rhythms that may not be detected during a standard ECG. But as you see your doctor and you're in normal rhythm, they put this monitor on you and they find out that the next day you had an episode of the irregular rhythm lasting an hour, but then it's gone and you're back into normal rhythm. It's important to consult with your doctor if you suspect you may have either migraine with aura or atrial fibrillation to receive an accurate diagnosis and appropriate treatment. Treatment options for migraine with aura and atrial fibrillation. Treatment strategies for migraine with aura and atrial fibrillation aim to reduce symptoms, improve quality of life, and prevent complications. For migraine with aura, treatment options include over-the-counter pain relievers, triptans, CGRP antibody drugs, medication for acute and preventative medication for headaches. Lifestyle changes such as stress, management techniques, regular sleep patterns can also reduce the frequency and severity of migraine. For atrial fibrillation, treatment options depend on the severity of symptoms and the presence of any other abnormal heart conditions. Medications may be prescribed to control the heart rate, restore normal rhythm, or prevent blood clots. In some cases, electrical cardioversion or catheter ablation, which means destruction of the heartbeat site, may be recommended to restore normal heart rhythm. Lifestyle modifications such as regular exercise, a heart-healthy diet, and stress reduction are also crucial for managing atrial fibrillation and reducing the risk of complications. Preventing atrial fibrillation involves managing underlying risk factors. This includes controlling blood pressure, managing diabetes, maintaining a healthy weight, and treating any underlying heart conditions. Regular checkups with your healthcare professional and adhering to prescribed medications are crucial for preventing complications associated with atrial fibrillation. At the end of this review, I'm going to list some medical articles that have documented the relationship between migraine with aura and atrial fibrillation. Dr. Chia-Chin Chung, etc., wrote on exploring the association between migraine and atrial fibrillation, utilizing a novel artificial intelligence ECG algorithm that was published in Headache Journal in 2022. And the study found a relationship between migraine and atrial fibrillation using a new ECG electrocardiogram algorithm. Also, Dr. Chang spoke at the American Headache Society meeting in Denver several years ago, stating individuals who had migraine with aura were more likely to have atrial fibrillation compared with those who had migraine without aura. The difference remains significant after we adjusted for age, sex, and 6 vascular risk factors, especially in those younger than 55 years of age, in both men and women. Another article was published by Skutinik, etc., entitled Review in the European Journal of Neurology on Migraine and Atrial Fibrillation, a systemic review, and that was published in 2022. An abstract statement was, the background and purpose, patients with migraine are at increased risk of stroke. The aim was to systemically review the current literature on the association between migraine and atrial fibrillation, which is a relative risk factor for stroke. So they looked at PubMed, which is a big list of articles for the terms looking at atrial fibrillation and migraine and atrial fibrillation. And after they looked at all, they concluded that population-based studies indicate a significant association of migraine with aura and atrial fibrillation. In practical terms, screening for atrial fibrillation in patients who have a long history of migraine might be reasonable, whereas in patients with stroke or other disorders and migraine, extensive screening for atrial fibrillation should be performed in all patients without migraine. All right, closing this up. In summary, I would like to say that there's ample medical data certifying the stroke proclivity associated with migraine with aura and atrial fibrillation. Patients with both of these problems should hearken to provided research and comments. Atrial fibrillation alone or with migraine with aura is always a problem that should be embraced with neurological and cardiac evaluation. So Godspeed to all you folks who had migraine with aura and atrial fibrillation. Hope you get attention for this. Check on my, give me a check on this for subscribe and like, and I'll see you again on the next talk. Thanks for listening.